number of new coronavirus cases reported in Los Angeles County in the last 24 hours is 825, with 26 additional deaths. Here in Torrance, 3 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Christine Lee. It's Wednesday, October 20th. The U.S. Food and Drug Administration authorized booster shots from both Moderna and Johnson & Johnson today. And in a related decision, the FDA also authorized boosters that are different from the original vaccination received. So a person who got a J&J vaccine could get a booster shot from Moderna or Pfizer. The regulatory moves allow booster shots to be used more widely. Now, a committee of advisors to the U.S. Centers for Disease Control and Prevention is scheduled to meet and discuss the Moderna and J&J booster shots tomorrow. They will make recommendations, and the CDC director will follow with a final call on vaccine guidelines. The additional booster rollouts can officially begin once the CDC formally issues its guidance. The White House announced detailed plans today on how more than 28 million 5 to 11-year-olds will be able to get the lower dose Pfizer vaccine once it's approved. Officials say kids in this younger age group will be able to access COVID-19 shots within days after approval from their pediatrician's office, pharmacy, and potentially even at schools. The Pfizer vaccine for younger kids also requires 2 doses 3 weeks apart, and they'll have to wait 2 weeks afterwards to be considered fully protected. The Biden administration noted that the expansion of shots to children under 12 will not look like the start of the country's vaccine rollout 10 months ago, when limited doses and inadequate capacity led to long waits for many. The White House says about 15 million vaccine doses will be shipped to providers across the U.S. in the first week after approval. The FDA and the CDC's advisory panels are expected to meet on November 2nd and 3rd. States can pre-order COVID-19 vaccine doses for the younger children this week. To help states and cities prepare for the rollout, the CDC issued a guidance on how to set up expanded vaccination programs. It also says immunization program managers can begin ordering doses today, but they will not be delivered until after the FDA and the CDC authorize the shot. Pharmacies in every state will be able to give the smaller dose shots to children. Kids ages 5 to 11 require a 10 microgram dose, which is 1/3 of the dose administered to those 12 and older. The CDC guidance warns that doctors should not try to split up or fraction the adult doses, and also recommends that pediatrician and family practice offices serve as primary places to administer the shots. Southwest Airlines canceled its plan to put some unvaccinated employees on unpaid leave in December. These are unvaccinated workers who applied for but haven't received a religious or medical exemption yet. A staff note from last Friday says if employees' requests for an exemption have not been approved by December 8th, they could continue to work while following mask and distancing guidelines until the request has been reviewed. The company is also giving employees until November 24th to finish their vaccinations or to apply for an exemption. Southwest will continue to pay employees while reviewing their requests, and if rejected, will keep them on board, quote, as we coordinate with them on meeting their requirements, vaccine or valid accommodation. This is a change from what was previously communicated. The company had said that these employees would be put on unpaid leave, and that is no longer the case. Southwest and American Airlines are federal contractors and subject to a Biden administration requirement of getting employees vaccinated by December 8th. Only exceptions are if they are exempt for having medical or religious reasons. The airlines are expected to face more questions about the mandate when they report quarterly results tomorrow morning. Israel will start offering the AstraZeneca vaccine starting tomorrow. It will be available for those with a specific medical referral, which will be given to those who cannot receive an mRNA vaccine for medical reasons or who experience significant side effects after getting the Pfizer vaccine. AstraZeneca comes in 2 doses, but unlike Pfizer and Moderna, it uses a weakened animal virus as a viral vector. It contains the coronavirus spike protein, so the body's cells will be able to recognize it and produce antibodies. Individuals who get 2 AstraZeneca shots and those who get an AstraZeneca shot after receiving 1 Pfizer dose will be considered fully vaccinated 14 days after the second shot. Those getting an AstraZeneca booster shot will become extra protected 2 weeks after the last dose as well. As of Monday, 6.2 million Israelis received at least one dose of a coronavirus vaccine. 5.7 million got at least 2 doses, and 3.8 million also got a booster. Last month, a U.S. clinical trial showed that AstraZeneca's COVID-19 vaccine demonstrated 74% efficacy at preventing symptomatic disease. The drug maker said in late July that it planned to file for full approval with the FDA rather than seek emergency use authorization. Well, clam chowder that is sold exclusively at Costco is being recalled because it may contain sharp plastic pieces. The Ivar's Kettle Classic Clam Chowder with uncured bacon is a ready-to-eat soup packaged in a double pack of 24-ounce clear plastic cups. The use-by date is December 22nd, 2021, which is printed on the bottom of the sleeve and on the end of the individual cup lids. A consumer found a piece of plastic with sharp edges in their soup this past Sunday, leading to the recall. Fortunately, no injuries were reported, but others who have this product at home are told to throw them away or return them for a refund. California Governor Gavin Newsom signed an executive order today in hopes of reducing the congestion at ports throughout the state. The order advises various departments to prioritize working with the Biden-Harris administration Supply Chain Disruptions Task Force to address state, national, and global supply chain challenges. It also instructs state agencies to create a long-term solution that boosts port operations, including infrastructure improvements and workforce development. Governor Newsom said, California's ports are critical to our local, state, and national economies, and the state is taking action to support goods movement in the face of global disruptions. This move comes after hundreds of cargo ships have been stuck off the coast of California over recent months. 64 cargo ships were at anchor as of today in LA and Long Beach, and in LA alone, 200,000 containers are sitting stuck at sea. The trucking industry is short 80,000 drivers, a record high, and needs to fill those positions to help fix the supply chain. Chris Spear, the president and CEO of the American Trucking Association, says that's a 30% increase from before the pandemic. The industry already faced a labor shortage of 61,500 drivers. Spear says many drivers are retiring or dropping out of the industry. And it's happening during a time when consumer demand is increasing and ports are backlogged primarily because there are few trucks and drivers available to pick up the cargo. Truck drivers move 71% of the U.S. economy's goods, but represent just 4% of the vehicles on the roads, according to Spear. If nothing is done, we're looking at a shortage of 160,000 drivers by 2030. A bipartisan infrastructure bill is currently awaiting action in Congress. If passed, it would authorize hundreds of billions of dollars for transportation, which would include workforce development for the trucking industry. It could also allow drivers as young as 18 years old to train and drive tractor trailers across state lines. The current age limit is 21. Bi-monthly, we share a Wellness Wednesday story to help you stay on top of this pandemic both emotionally and physically. October is Domestic Violence Awareness Month, and as a survivor, this is a month that's dear to my heart. According to the National Coalition Against Domestic Violence, nearly 20 people are physically abused by an intimate partner every minute in the U.S. That's more than 10 million men and women during a single year. 1 in 4 women and 1 in 9 men experience domestic violence. And more than 20,000 phone calls are made to domestic violence hotlines every day. Right here in Torrance, there is a nonprofit ready and waiting to help anyone in the South Bay and beyond who may be experiencing domestic violence. Joining me right now is Michelle Nadeau, volunteer and outreach coordinator with the 1736 Family Crisis Center. Michelle, thank you so much for being here.
Thank you so much for having me today.
Well, let's start with a general overview on what domestic violence is and is not.
Well, domestic violence is not confined to any type of socioeconomic demographic, right? It's not just physical abuse. It's actually it's an increasingly frequent and severe cycle of physical, verbal, emotional, psychological, and or sexual abuse for the purpose of intimidation, instilling fear, and controlling behavior. So call it kind of a coercive control. What's important to note that domestic and intimate partner abuse can take many different forms, and it's just not physical. It takes on a lot of different dynamics as well. The important thing is that it's a cycle that increases in frequency and severity.
Yeah, and tell me about the important work that you and the others do at your organization.
1736 Family Crisis Center is nearing 50 years of providing services to those that are most vulnerable in our community, survivors of domestic violence and human trafficking, youth in crisis, and homeless veterans and their families. We have wraparound supportive services for both residential and non-residential clients. We provide mental health support, legal services, housing services, case management, whatever that individual or those individual family members need to move on and to be safe and self-sufficient.
You do so much. Now, did COVID-19 affect any of the work that you do?
We definitely needed to adapt to the restrictions and all of the dangers of the spread of COVID, but we are very proud that our services just continued throughout the pandemic. Like I said, we have all of our different services and shelter, including our shelter services, that we are able to continue adapting for social distancing within our shelters, but still maintaining the capacities that we serve. Although all of our in-person sessions needed to be remote, and some of them still are virtual, we're moving towards in-person session now, but very gradually and just, cautiously. But our hotlines remained in operation, our shelters, our veteran services, everything continued on.
That's great to hear. And for those who may be experiencing domestic violence right now and want to seek help, what can they do?
If you're experiencing domestic violence now, we have 5 hotline numbers that are 24-hour, 7 days a week, staffed by professionals that are trained to assess and screen, and that's the main access to our services. If you're not in immediate danger, your plan could be to identify those nearest to you that are safe and trusted, and maybe come up with some kind of code word or phrase so that they'll know what you're going through. If you are in a casual conversation that may be being overheard, if there's a code word or phrase that you give them, they will know that you are in immediate danger and that they will send help. Amassing different types of documents, important information that you can keep in a safe place in your home and in your car. But just know that if you come to our shelter and you have nothing, that's what our teams are there for. So we've had families that come to us with absolutely nothing, and we rebuild and get you to a point where you can move on and towards a violence-free life.
And Michelle, during a recent conversation that we had, you mentioned that one of the questions you get asked the most is, well, why don't they just leave, right?
Yeah, I think an important part of understanding the dynamic of domestic violence is understanding why people stay in abusive relationships, right? There's a lot, there's fear of harm if they do leave, of isolation or loneliness. And a lot of that, what the abuser uses to control the victim is isolating that victim from family or friends. And so already the victim is feeling that isolation. So there's a fear of just being totally alone, or they still love their abuser and they think that they'll change. And if every time the abuser says, this won't happen again, they believe that. Immigration status, if victims are undocumented or they have a language barrier, that's a huge limitation of their knowledge of resources. Children, people may stay for the children thinking that they need to keep the family together, but then ironically, children are sometimes the catalyst for leaving. Normalized abuse, if someone grows up in an environment where abuse is common, they sometimes don't recognize the signs of unhealthy relationships. Religious and cultural beliefs that don't support divorce or may dictate gender roles, and they keep the victim trapped in the relationship. There's a lot going on within a victim that makes them stay or that causes them to not leave. And it's important to understand what can be going on with them internally.
Yeah, and I can totally relate to that. I remember from my personal experience just how important it was to have the support from family members and friends. Can you share some advice to those who may be wanting to help someone who they believe is in an abusive relationship?
I think if you think that a friend is going through something like that, to not be afraid to reach out and say, hey, I'm concerned. I know that you've been isolated or anxious. I mean, those are key signs or bruises. Make time for them to open up, because hopefully they will, and listen without judgment, and not say, why don't you just leave? Or why didn't you do such and such? Just listen without judgment, knowing that there are resources for your friend, and offer to go with them. I'll go with you to a service provider. I'll help you seek help. Let's call this number together. And be the person. Let's get your birth certificate, social security card together. I'll keep it for you, or things like that. But just to let your friend know that you are there with just unconditional support, non-judgmental support. A lot of victims deal with shame, difficulty admitting that there's abuse going on. So being cognizant of reasons why people stay can help you reach out and be a catalyst and that brave step for them to go forward and seek help. And I understand also that has to be their decision. We've had people coming into our offices and my friends being abused, my sisters being abused. You need to call them, and we can't call them. They need to call us. So as much as you're helping and trying to support, that decision needs to be theirs.
Well, thank you so much again, Michelle, for being here today and for chatting with me.
It's so great to be here. Thank you for having me. This is a great way to get the word out and to increase awareness of Domestic Violence Awareness Month. I think it's, thank you so much for all that you guys are doing.
Of course. And here is a list of 24-hour crisis hotlines if you want to jot them down. And for more information about 1736 Family Crisis Center, you can visit 1736fcc.org. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. The city's public works staff came to the rescue of a fifth grader this week. Benjamin Birch and Gilbert Martinez got called to Arlington Elementary School to help a student who was in tears after accidentally dropping her brand new cell phone into a storm drain. Her dad had called the city for help, and Benjamin says they were more than happy to spend a few minutes to help retrieve the lost phone.
It feels good to be able to help pretty much anybody in the city. I mean, a phone for a kid, it's a lifeline. It's everything to kids these days. So it feels good to be able to get their possession back to them that keeps them connected with the school, with their friends, with their family, and just in general, just helping out a person in need.
Thank you, Benjamin and Gilbert, for saving the day. Now, if you have a great story, upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 Today. We'll see you back here tomorrow as Bella Shaw brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.